Guess what? You're watching It's Your Health. I'm here with my bride, Kathleen. We're going to inform you and entertain you over the next 30 minutes, the fastest 30 minutes in television history. Remember to check with your healthcare provider before doing any of the things that we talk about here on It's Your Health.
I have a few questions then for my healthcare provider. We'll be right back.
After this brief commercial message. Welcome back to the first segment of It's Your Health. Before we start today's show, though, I'm asking for anyone out there in television land, and this is serious, to call me with any information that they have on this so-called overlook.
It's not so-called by some people.
The overlook, every time I talk to someone, they tell me, oh, they have an aunt that knew some prayers regarding the evil eye, the Mala'ok. And oh, they've passed on, or they had a neighbor who did something. And I'm trying to assemble some bits and pieces for this Italian tradition. So you have to help me out there. Give me a call. And
he's fearful that it's dying, the information is just dying out, and people don't know.
It's like an Easter pie recipe. The people who do it and did it well are now gone. So I need to sort of collect all these things.
Don't call me.
Okay.
I'm not collecting it.
Moving right along.
Okay. Welcome to the show. First headline. Listen to what he gave me to read. Iatrogenic gastric acid suppression and the risk of nosocomial Clostridium difficile infection.
I'll explain that, sweetheart.
Good.
What they're talking about is that a lot of people out there in television land are on acid suppressants like Protonix, Nexium, Zantac for agita, for reflux symptoms, too much acid. And in suppressing the gastric acid, you are allowing bacteria that would ordinarily be killed by the gastric acid to flourish. So we're seeing more of these C. difficile bowel infections, diarrhea, because of people on gastric acid suppressants when they really don't need them, or they're taking them inappropriately, or they're taking them too long.
Is it normal to have the acid?
Well, yes and no. I mean, everyone has to have gastric acid for digestion, but if you have too much, you can get reflux symptoms or get an ulcer. So if you're on these medicines, some people like them because they feel better on them, and they might be causing an increase in bowel bacteria, because the bacteria is getting to the bowel where it ordinarily would have been killed in the stomach.
Or as kindergartners would say, the vowels.
That's right.
Next headline. Popular drugs lower PSA levels. Of course, we're talking about the care of the prostate. Many men take NSAIDs, I don't know what they are, for their cardiovascular health. So we need to know whether these reduce prostate cancer risk, or they simply reduce the number for the PSA, which would then make the test unreliable.
That's right. One of the ways to deal with prostate health is to do a digital rectal exam, and of course check your PSA. And what this article is telling us is if you're on statins, if you're on anti-inflammatory agents.
Give us an example.
Zocor, Lipitor, Vytorin, things to lower your cholesterol. And if you're on aspirin, or if you're on anti-inflammatories, arthritic medications, these medicines interfere with the measurement of the test, and the PSA can actually be higher, but because of these medicines you're on, the result is lower. So you get a low PSA and you think I'm okay, when actually it's high.
Oh, wow. That's not good. Next headline. This is from the New York Times. This one made me nervous. Salons' nail lights can cause skin cancer. An often overlooked source of ultraviolet radiation can be found in many nail salons, where we put our hands so that our nails dry quickly. That's like putting our hands in a miniature tanning bed. And using the nail lights even just once a week can add up to significant exposure. You're recommended to let your nails dry on their own It takes longer, but it'll save your skin.
Yeah, good advice.
Skin cancer. Who would think that? Imagine that. I can't imagine that.
It's a dangerous world out there, Teach.
Okay. Conjunctivitis. It's common in the United States.
Well, I'm going to show you a picture of
good.
somebody's eye. That's pink eye.
Oh, okay. I know what that is.
And contagious, of course, especially in kids because they're wiping their eye and then they go touch somebody else. And
Always had to clean all the desks after somebody got it in school.
right. And the thing with the pink eye is in the olden days we used to use sulfa drugs and it would take care of it pretty quickly, but the bugs are getting smarter and stronger, so we now have to use Cipro-like drugs, stronger antibiotics for these bacterial infections. So if your eye looks like that, check with your doctor and don't go to school.
Yeah, right. Or work. Oh, well, I knew we couldn't skip this. Menopause and hot flashes. How long will I have hot flashes? It varies among women. Some women have it for a short time. Some women have it for years. Can I prevent hot flashes?
Well, look on your screen and you'll see some of the things that we would recommend. You would recommend. It doesn't work.
Well, I don't, but are there non-prescription ways to?
I'm glad you asked that. Look
Thank you.
Look at your television set and you'll see non-prescription ways of dealing with menopausal symptoms, vitamins and Motrin, Nuprin or Advil. And of course there's prescription drugs if you check that out. So help is available, sweetheart.
I've tried most of this stuff.
It hasn't helped, huh?
No, you just have to be hot and need to be somewhere. I was somewhere with Daniel, and I had to excuse myself and leave because I was so hot I couldn't stand being in the room anymore.
Huh.
And you weren't even there.
You're kidding.
No.
Oh, my goodness.
Okay. We have questions from some of our viewers that we've been holding for a while. This woman says sometimes she gets a twinge in her breast. Is that dangerous?
Well, breast pain is concerning, and I think what you should do is make sure you're up to date on your mammograms. And some of the thing that really twists me is that when I examine women, I say, when's the last time you checked yourself? Well, we don't do it. And you really need to every month examine your breasts. You have that opportunity, and you could bring to our attention something that doesn't belong there. So please do that.
Okay, very quickly. This woman has a burning sensation down the middle of her chest.
Well, it could be acid indigestion, but of course women and heart disease, sometimes they don't always read the textbooks and have the textbook symptoms. So chest pain in anyone is considered cardiac, or at least I would try to rule that out first before going into acid reflux or arthritis of the chest or gallbladder disease or stress. So you need to check your coronaries first.
Well, he's talked so much that we can't even get to the next question that I have here from a poor person who's been waiting forever for you to answer it. So we're going to take a brief commercial break, and we'll be right back, and maybe we'll be able to get more done. I don't know.
Remember, you're watching It's Your Health. It's your leader in healthcare information. Be right back. Welcome back to the second segment. It's football time. We'll have to get into that a little bit later.
How depressing.
After I'm... There's a cartoon I gave Sammy. It has a husband and wife sitting there, and the husband says, "You realize we've been together for 25 seasons?"
That's about right. That's about right.
Could we answer questions now?
No, because speaking of depression, women are depressed more than men. Well, that's because men depress us by the stupid things they say and do. But that's not the point. Men are undertreated because they talk about depression and experiences differently than women. But here's the real problem. Men are not likely to seek treatment. Women get treated for depression. Men are more likely to commit suicide.
Yeah, that's unfortunate that men are not able to verbalize their feelings. They get into self-abusive behaviors, and some of these can be deadly. So I think if you have a loved one out there and they're exhibiting some signs of depression, withdrawal, anger, short fuse, difficulty concentrating, poor sleep
like the
habits.
way they normally are every day.
So they really should seek treatment because treatment's available. But they're guys, and guys are tough, and they don't want to do that. They want to tough it out.
Except when they're watching television and they want you to go get them a beer. Then they're not tough enough to get up and go get it themselves.
It's a good thing I don't do that.
That's right. Next. Flu vaccine is arriving. Well, ours has already arrived. For the first time ever, the seasonal flu vaccine is recommended by the CDC for all men, women, including pregnant women, and children over the age of 6 months. The flu bug has already begun popping up in states across the United States, including 2 unrelated outbreaks already in Iowa.
Yeah, you'll start seeing it, of course, pop up here and there. We really would like the flu shot given around this time. Generally, October is your best time. It lasts 2 to 3 months once you have the shot. And of course, come Thanksgiving and Christmas, when everybody's traveling and mingling and you're in enclosed areas, that's when the flu really takes off.
The CDC says it lasts for 6 months.
What does?
The flu vaccine.
Oh, it does?
That's what it says.
They must have improved it.
I guess. Okay. That's okay. You can be wrong once.
Once. Yo, once.
White rice, brown rice, and risk of type 2 diabetes. Who would have thought? Substitution of whole grains, including brown rice, for white rice lowers the risk of type 2 diabetes. That supports the recommendation that most carbohydrate intake should come from whole grains rather than refined grains.
That's right. I don't want to say anything and be wrong, but so you're right there.
Thank you. So when I make the rice, that's why I make the whole grain or brown rice or long grain.
Now, wait a minute. When's the last time you boiled anything in our kitchen? You know we have a gas stove. Do you realize that? You've never been there. She thinks we have an electric stove.
But it doesn't turn on, so what good is it? I turn the knobs and nothing happens. So I can't use it. Okay, this was just on the news this morning. Not this exact one. Bed bugs do not cause illness. We have a terrible outbreak in the United States. They deliver bites that make the skin itch and may prove difficult to get out of your house. But patients who get these bites are assured that the pests do not carry disease. There's a worldwide increase in bed bug problems, and it's tenfold in the United States. The worst areas is the midsection of the country. Don't put your suitcase on the floor anywhere. When you come home, wash all your clothes, even if you haven't worn some of them, and take your vacuum hose and clean the inside of your suitcase, and be very, very careful. And I'm not sure I believe them that they're not bad, because they're really ugly.
Well, there's a picture of one,
Yeah.
and as our mother would tell us, don't let the bed bugs bite.
Right. And if you go to some hotel, take off the sheets and look at the mattress or the mattress pad, and if there are tiny, tiny, tiny drops, you don't want to stay there.
They look like what?
They're just tiny drops of no bigger than a pin end
Looks like dirt.
Of dirt or blood even.
Oh, you're kidding.
And the baby ones are almost impossible to see because they haven't eaten yet.
I see. Okay. I think we've had enough of the bed bugs.
Yeah, well, I think so too. We have another question. This woman wants to know if she should stop taking Zocor because she's experiencing hair loss.
Well, there are numerous reasons for a woman to have hair loss. Zocor would be a remote but possible cause. Any drug can do it. So I think she needs to get further looked at.
You don't take Zocor, do you?
No, I don't. I don't need it.
Just checking. Okay, this new nail gel. I don't know how to pronounce it. Nonix, and it's an exfoliant.
Yeah, how do you like that? You see the before and after pictures? There's a lot of toes out there that look like that, and this particular medication, after a couple of months of use, will turn your nail from the one on the left to the one on the right.
Yeah, my mother was a diabetic, and hers looked just like the one on the left. And no matter what you did, you know, you could get a pedicure, didn't matter.
Yeah,
didn't change anything.
They're deep-seated infections.
Vertigo. You make me dizzy.
Dizzy broad. Well, we're talking about dizziness, and there's a simple test we use in the office to determine whether or not this is from your inner ear, or what we call benign positional vertigo. And what we do is we lie one down and we turn their head back and forth.
That'll make me dizzy.
To slosh the fluid in the inner canal. And if it reproduces the dizziness, then we are pretty confident you have benign positional vertigo, which is positional dizziness.
Okay. And there's one thing I want to get in very quickly before the break, and that's talking about people's waistline.
Yes.
And if a woman's waistline is more than 35, I think, and if a man's waistline is greater than 40 inches, you are at higher risk for type 2 diabetes, for heart condition, for high blood pressure. And somehow they found this correlation, and it works even better than your body mass index.
Right.
Check the size of your waist, and don't cheat.
And don't cheat and don't move that dial, because we're entering our last segment of It's Your Health. Remember, we are your leader in healthcare information. Be right back.
Welcome back to the final segment of It's Your Health. What do you have there under that football?
Would you believe this? Someone gave me a picture of first grade, 1959, myself, at Holy Trinity School. We had two classes in one, believe it or not. First and second grade was together, and we'll show you a picture, and there's a local celebrity on this picture as well. I don't know if you'll be able to pick them out.
You?
No, not me. But
you're on there, right?
I am on here. And it was a terrific time in one's life. Look how we're all dressed up. And it was just one of those things, a day gone by, if you will. It's like a time gone by. No one will ever be able to experience the time we had in these small parochial schools, treated and trained by dedicated nuns. Just unbelievable. It's too bad.
And I have another question. This is a Penn State football.
Oh, yes, it is.
Didn't you notice that when you put it here?
Well, it was a gift from John Cappelletti, who wrote on it, Luck of the Irish. And underneath it he says, that one hurt. So I have to have it around here. So
well, just to mention, over at my Whitehaven Kathleen's Collectibles shop, I happen to have a Penn State one signed by none other than Joe Paterno.
Get out.
For sale.
He doesn't do that very often.
Well, I have one. Okay, let's do the headlines.
You can keep it.
Keep using statins despite diabetes risk. Although new research shows that the use of statins increases risk of developing type 2 diabetes, the risk is low.
I'm not sure how this came about, but people who have high cholesterol are going to naturally have higher sugars, and so I'm not so sure there's a cause and effect per se, but this article suggests there is. The point is this, that if you have underlying high cholesterol, it needs to be controlled either by diet, weight loss, exercise, and if you want to, you need to consider taking drug therapy, a statin, Zocor, Lipitor, Vytorin, and the like, Crestor. They are generally safe, free of side effects, despite what you hear on the internet, and they really do lower one's cholesterol. And just as a story, I'm going to tell you, we measure plaque buildup in people's carotid arteries, called a carotid ultrasound, and they will come back showing 75%, 80% blockages. We put people on statins. We wait 2 years and we repeat these studies, and these plaques disappear. They melt away. So you can actually get almost a fountain of youth. You get reversal of disease, which is unheard of. So I really would encourage you to consider these medications.
Wow, I'll say. And from that, we're going to go to red yeast rice for hypercholesterolemia in people with statin-related myalgias. Go right ahead.
Well, I already told you that statins are generally safe, but some people can't take them. They get muscle aches and pains. So what do? You turn to a medication that we actually sell here. It's not a medication. It's red yeast rice, and it will lower your LDL, the bad cholesterol, up to about 40 to 50 points. Unbelievable. No side effects. It's not a drug. It doesn't have to be monitored other than watching your cholesterol. Doesn't cause muscle aches or pains, doesn't interfere with other medications, doesn't cause liver or kidney issues. So if you don't like the idea of taking a statin, look into red yeast rice. We have it here called LDL reducer, 40, 50 points.
While you're looking into it, though, talk to your doctor about it before you start.
Good point.
Thank you. Polymedication, a problem for seniors and how to cut their risk. The elderly are considered highly vulnerable to drug-related adverse effects, in part because they use numerous medications, often in inappropriate doses relative to their age. Elderly individuals might not adhere properly to the regimen for the medication due to their change in mental or physical status. And they may overuse or not use, or the big problem, two doctors may be prescribing medications that are at odds with each other.
Yeah, 2 or 3 or 4 doctors. You know, if you have conditions, chances are you have multiple doctors writing multiple prescriptions. The point is this: polypharmacy is out there, it's real. I end up pulling my hair out because when I sometimes see a patient that the patient is on 4 or more drugs, after 4 or more drugs they start interacting with each other and having side effects. So one of the first things I do is I say, bring all your medications with a brown bag and I'm going to sort them out and see which ones you don't need. Some people have been taking 2 medicines treating the same thing. It really is a big problem.
And if you see a couple doctors, you might say, well, who do I take them all to? Take them all to whoever is your primary care doctor. And I have known cases of people that I know personally treated by him, and it was almost like it was a miracle how much better they got. And all he did was take away some of the medicines they were on.
Yeah, we took away some and people woke up.
Okay, more hair questions. This patient says their hair is, he's a 67-year-old man, he's white, and his hair's white, but now it's turning yellow.
Well, it could be the water, if he has heavy metals in the water. More likely it's a shampoo. Some of the shampoos, particularly the anti-dandruff ones, will turn your hair yellow or green, believe it or not. That happened to me once. So I have this blue shampoo that one of my patients turned me on. So now it's just silvery.
I bought that shampoo.
Oh, what's that? Maybe you were the patient.
I guess so.
Okay.
Okay. This is a very interesting question. And at what age do you stop breast cancer screening? Some women who are 75 and older in good health may benefit from mammography, but the oldest women, they're saying now, just let them go.
Well, it is controversial. I think if you have a breast or 2, they should always be examined and you should be offered mammography at any age. As one gets older, there's less estrogen around. We think that these cancers are less aggressive than if you were younger because of that fact. But I'm sorry, they have to be examined at any age, no matter what your health situation is.
I really don't like this when you discuss stopping screening with older women who have shorter life expectancies. I think that is totally inappropriate, and we have to end on something fun. So let's end with dogs. Do you know that they have proven that dogs automatically and voluntarily imitate the behavior of their owners? So for example, if the owner got down on all fours and rang a bell, they gave the dog a treat if the dog didn't do it. The dogs didn't want the treat. They wanted to do what their owner did. They have the ability to recognize what pleases their owner, and they try to imitate that behavior. That's why you might notice when you get ready for bed, they get ready for bed. When you get up in the morning, they're up in the morning. They don't stay in bed. All dogs are bent on copying their owners, even if there's no reward. And a few years ago, they discovered, and watch for this, that when people yawn, their dogs will yawn.
Oh man, that's pretty wild.
And with that,
It says it all. Thank you for allowing us to come into your home and inform and hopefully entertain you. I got a muscle cramp. Must be my statins.
Yeah.